Hello everyone, this is Joubert speaking, and today I'm going to be taking us through sexual sadism disorder, which falls under the class of paraphilic disorders. So, what is sexual sadism disorder, also known as SSD? Well, the diagnostic criteria highlight that it's an intense and recurrent sexual arousal from the suffering of others. This includes acts such as being beaten, humiliated, or bound. The individuals may have urges, fantasies, or take part in these activities. Events of arousal must be intense and recurrent for at least 6 months, and the person has to be suffering from clinically significant distress or impairment or have acted upon a non-consenting person. It's worth noting the topic of BDSM when discussing sexual sadism disorder. BDSM relates to bondage and discipline or dominance and submission, as well as sadism and masochism. In fact, BDSM actually used to be called sadomasochism. When a psychologist is looking to make a diagnosis of SSD, there's a few important factors to keep in mind. Firstly, a person may just have sexually sadistic interests. This particularly the case if there's no signs of distress or impairment, and if no actions have been done upon a non-consenting person. The diagnostic criteria are applicable for those who openly admit to these paraphilic interests, but also those who deny having them despite contradictory evidence. Recurrent acts could also apply to multiple separate or one specific individual, though it might be easier to diagnose someone with SSD if they've had multiple different victims, because this gives us an idea of the actual motives behind their actions. It may be useful to have detailed personal history of a client, and this could include insight towards any childhood abuse, which actually increases sadistic tendencies. Furthermore, the dangers associated with SSD. It's important to keep in mind the topic of coercive sexual sadism with aggressive behavior. It's been implicated in a number of sexual homicides, not to mention danger for the actual individual who has the disorder, as there's an association of shame and guilt due to stigma from the public, which could often lead to ideas of suicide. People who cause sexual assault or rape, despite their direct infliction of pain, cannot be diagnosed with SSD unless they admit to being sexually aroused by the pain specifically. The same concept applies to individuals who may have conduct disorder or antisocial personality disorder. Those who meet the criteria for both of those disorders may be diagnosed with both disorders. Patients may also actually present as a switch, in which case they can be both dominant or submissive, hence sadistic or masochistic. A person living with SSD is sure to have a complicated life, in particular, complicated sex life and social life. The person probably has an extensive use of pornography depicting sadistic acts. And a study by Benamau found that most participants would actually like to practice their sadism more often, though they actually find it difficult to meet potential partners. A third of the sample were men hiding their activities from their marital partners. And they also explained that BDSM clubs were the preferred places to meet their partners. Some of the men had their own dungeons in their house or actually at a rented place, and they felt that their activities added to their psychological stability. Sadists are also known to partake in risky activities such as extreme sports or various violent activities, and it's important to note that they face stigma, which could lead to a lower quality of life, as well as shame, discrimination, and other further psychological problems. SSD may also present with various other disorders. So now we can discuss comorbidity. So the most common comorbid disorders with SSD are actually other paraphilic psychiatric disorders. Among these include exhibitionism, voyeurism, masochism, and transvestic fetishism. Links between SSD and psychopathy have also been found in sexual murders. And it's worth noting that people with conduct disorder or antisocial personality disorder can also be diagnosed with SSD, though there must be evidence that they have sexual arousal from the suffering of their victims. So where does this all come from and how does it occur? Well, research on SSD is actually still quite limited, particularly on its development. However, the clearest link is with childhood abuse, especially that of a sexual nature. It's important to keep in mind that a person develops their sexuality throughout their life, though the most integral parts of its forming actually take place during the childhood. Connections have also been made to an exposure at an early age to violent pornography. Correlations have also been made between substance abuse and sadism. Though sexual sadism interests are likely lifelong, they can decrease with age, just as sex drive can decrease with age. It's worth noting that people who take part in BDSM actually tend to become aware of their interests in their teenage years. Sexual sadism disorder can be found in both men and women. Though it's important to note that most study sample groups for SSD are actually made up of male criminals. Despite this, we have been able to get a few representative samples. A specific study showed a prevalence for lifelong sexually sadistic behaviors among women to be 2.3%, whereas it was 2.7% for men. Female sexual sadism is actually one of the least prevalent paraphilias. And in research conducted by Abrams regarding childhood sexual abuse, more males showed sadistic interests, while more females actually showed masochistic interests. Cultural context plays a large role with regards to this topic, especially as of recent because of media such as 50 Shades of Grey. You see, views on sadism have been greatly influenced by culture, though those with SSD may still face guilt and shame due to stigma. Though the recent popularity of movies and books, such as the 50 Shades of Grey books, have actually increased cultural awareness that masochism or sadism may be a way to express intimacy and one's sexuality. Though according to Oliviera et al., the books actually turned perversion into something marketable, because the books aroused an interest in readers who wanted to know and experience feelings from the books. Links are still made to rape and sexual homicide, however, in culture, and legislation concerning sexually sadistic activities also vary between societies. This is possibly due to different cultural perceptions of what distress actually is, then again relating to the criteria. Discerning between sexual sadistic activities and intimate partner violence is an extremely important thing to consider here as well, especially in a South African context, where 26% of women in South Africa have reported experiencing intimate partner violence, also known as IPV. Diving deeper into those statistics, 6% of women with or previously with partners reported experiencing sexual violence, 17% of them emotional violence, and 20% of them physical violence. When discussing possible prevention strategies, we look back to what causes the disorder in the first place. So, considering this, we should consider the role of abuse. Abuse should be avoided in all ways possible. That applies to those who may be abusing others, as well as those who could possibly escape abuse. Those with childhood trauma should actually try to seek therapy to try and resolve it, rather. People should also be aware of their friend groups, as their friend groups may expose them to the practice. The same applies to awareness of one's child's friend groups. People could also be aware of the exposure to their kids through media, such as the 50 Shades of Grey books, movies, as well as pornography. Those with paraphilias who may be at risk for developing SSD should also consider seeking help from professionals or possibly join prevention programs. Finally, we get to the topic of the impact that the disorder has on the family and loved ones of an individual with SSD. Partners in sadomasochistic relationships may actually find the activities to enhance their bonding, though it also has ties with interpersonal violence. Abusive relationships can be disguised as being sadomasochistic relationships in nature, just with consent, though it is a certain type of IPV. These relationships can be defined as having a lack of pleasure in these activities. They can also be characterized by a continuous fear outside of them. Another point to make is the potential financial impact that it might have if someone with SSD is spending an excessive amount of money on their dungeon, whether they may be renting it. I have been Louis Joubert speaking about sexual sadism disorder, and thank you very much for listening.